Hello everyone, my name is Thomas and today we're going to talk about how to wash our hands in a clinical setting. Hand washing is very, very important when you work in a hospital or a doctor's office. Hands promote the transmission of bacteria, germs, and you don't want to get your already ill patients even more ill because you didn't take the necessary hand washing techniques. Okay, today we're going to talk about how to wash our hands in a clinical setting. First, make sure we have no jewelry present on our hands or wrists. Jewelry is one of the most effective ways to spread germs to a patient, so we want to make sure we don't have jewelry on when we're seeing patients. As a matter of fact, most medical facilities don't allow their clinicians or practitioners to wear jewelry in the workplace. Second thing, if we have on long sleeves like I do, we want to roll our sleeves up. We want to make sure that our sleeves don't get wet in the process of washing and sterilizing our hands. We want to at least go elbow length with the sleeves. Okay. And as you can see now, I'm jewelry free and my sleeves are rolled up. Next step, we go to the laboratory within our facility. We locate the sink, the towel dispenser, and the soap. You have some soap dispensers that are in a portable bottle next to the sink, and you have some that are on the wall. Most medical facilities have them propped on the wall these days just to make it easier and keep the sink clear of space. So our next step would be to extract a piece of towel from the machine. We want to turn the faucet on, turn the cold on, turn the hot on. We want the water at least lukewarm to hot as possible. That way we kill as many germs as possible. Okay, our next step, we discard the paper towel. We give our hands a few pumps of the soap, and then we start to rub. We want to wet our hands slightly. The main part of our hands that really gravitate the germs are the palms. So we want to start there. We want to spend at least 15 seconds on the palms. Our next step would be the back of the hand and between the fingers. We want to take our right hand, put it on top of the left. We want to go in a back and forth motion between the fingers. We want to do the top of the fingers and the back of the hand. Okay, we want to spend at least 15 seconds doing that. Next, we reverse it with the next hand. We take the left hand, put it on top of the right hand. We want to go in a back and forth motion. We want to get between the fingers on top of the fingers for at least 15 seconds. Hand washing techniques are very important. Spread of germs is one of the #1 causes of illnesses in medical facilities. Our next step, we want to do the wrist. If we need more soap, we just give it a pump or two, and we start to do the wrist. Now each wrist you should do about 15 seconds. Wrists are very important because they do come in contact with the patient for anyone that handles, that is doing patient care. You can alternate back and forth. I find the easiest way to do it is just to spend 15 seconds on each one. Just count to yourself. Go in a circular roller motion on each one. Okay, so to reiterate, we've done our palms, we've done the back of each hand, we've done between each fingers, we've done the top of the fingers, we've done each wrist, we've soaped everything up, and now we're ready to rinse. Now, remember we have the water running at a lukewarm to hot temperature. We've already tested it. We extend our hands underneath the sink, underneath the water, and we just stroke each hand and the fingers. Okay, we want to make sure that all the lather is gone. It's washing those bad germs away. Once we've done extracting the soap, we want to make sure any excess is gone. We just want to extend our fingers over the sink and our hands. We want to make sure they extend it downward. We don't want water rolling back up on our sleeves. Next, we extract the paper towel, and we're going to pat dry our hands. Pat dry the back. We're going to do the front. We can extract this into the trash can. We can extract another paper towel from the machine. Pat dry. We want to toss away this paper towel. The most important thing, we want to keep our hands away from the sink. Now that they're sterilized, we want to keep them away from our body. Our next step, we want to extract another paper towel. We want to turn off the faucet using the paper towel. We do not want to dirty our hands. We've already decontaminated our hands with the antibacterial soap in the 15 seconds on each section of washing our hands. So now we want to use the paper towel to turn off each faucet, and we want to discard the paper towel. Now we have clean hands on the front, back, We want to make sure that we keep them away from our body in the sink, and now we're ready to go see our patient. And that was our instructions today on how to wash hands in a clinical environment. Thank you very much.